When patients need fast relief from oral discomfort, speed and precision matter. HurriCaine ONE with 20% benzocaine is a powerful topical anesthetic designed to quickly numb the mucosal surface, helping reduce pain during oral and scoping procedures. Formulated with 20% benzocaine, HurriCaine ONE works directly at the application site to temporarily block nerve signals, providing rapid, localized numbing of the throat and oral tissues. This makes it ideal for procedures like endoscopy, intubation prep, and other short-duration interventions where patient comfort is critical. Each single-use applicator delivers a controlled 0.5 milliliter dose, reducing the risk of cross-contamination and eliminating medication waste. With no aerosols or propellants, it's a safer, more controlled alternative to traditional sprays. Using HurriCaine ONE with benzocaine is simple. First, tear at the notch and remove the unit from the pouch. Next, turn clockwise to unlock. Hold the applicator firmly with 2 fingers on the grip and your thumb on the plunger. Position the patient with their mouth open and aim the spray tip toward the back of the throat. Press the plunger firmly to deliver the dose. Then instruct the patient to swallow 1 to 2 times to help distribute the anesthetic. Numbing begins within 10 to 30 seconds and lasts approximately 15 minutes, giving you a reliable window to perform your procedure. With rapid onset, controlled dosing, and single-use safety, HurriCaine ONE with benzocaine helps improve patient comfort while supporting clinical efficiency. HurriCaine ONE, precise, fast-acting oral anesthesia when and where you need it. Learn more at nuancemedical.com/HurriCaine ONE.